According to health experts, being physically inactive is a major risk factor for developing non-communicable diseases such as cardiovascular diseases, high blood pressure, cancers, chronic respiratory diseases, and diabetes. These diseases are some of the leading risk factors for global mortality in Uganda. Non-communicable diseases are responsible for nearly half or 41% of deaths and also account for 30 to 35% of patient admissions in health facilities. Dr. Charles Oyo Akia is the Commissioner for Non-Communicable Diseases in the Ministry of Health.
Of the different NCDs, the top leading is cardiovascular diseases. These are diseases of the heart and the blood vessels like hypertension, heart disease, and stroke, which we all know. And that contributes, I said, is 12%. And then 11% is due to mental health disorders, mental health conditions, including substance abuse, alcohol misuse, and others. And diabetes accounts for 4% of the mortality, and cancers contributes about 15% of the mortality, and chronic obstructive pulmonary diseases like asthma account for about 5%.
The Ministry of Health is set to hold the annual National Physical Activity Day on Sunday, 18th June at the Kololo Independence Grounds as a way to promote awareness in the public and prevent these diseases.
1, 2, 3, 4, 5, 6.
According to Margaret Muhanga Mugisa, the State Minister for Health in charge of primary health care, physical inactivity is the fourth leading factor causing diseases and death. She therefore encouraged people to regularly engage in exercises, reduce alcohol consumption and smoking, and have regular medical checkups. Some of these will be on a free offer during the National Physical Activity Day on the 18th of June 2023 at the Kololo Independence Grounds.
The NCDs indeed are a disease burden everywhere in the world. There are some countries which have obesity at 60%, which is really dangerous. But it's quite dangerous. It's not a nice thing to be known for, that this is a country which consumes a lot of alcohol. You can drink, but very little. You don't have to drink yourself to death. Also do regular checkups. However young you are, the moment you cross 35, that is diminishing returns.
The Minister adds that as a way of encouraging physical activity, the Ministry of Health is collaborating with the Ministry of Education and Sport to see that every school embraces physical activities.
We have requested the Ministry of Education to have these among the teachers, such that at least every 1 day in a week is dedicated to exercise. From kindergarten to university, people must be involved in physical activity.
A prominent kickboxer, Kololo Moses, who is an ambassador for physical activity, also encouraged people to work out and engage in physical exercises, saying that it will help them live a healthy life. He also appealed to the Ministry of Health to engage its partners in government and the private sector to enable schools get physical fitness instructors. Kololo explains that this will not only help boost physical activity, but also develop talents.
We believe that if these exercises are being taken to the school, these children, they will become more better. Talents, if you don't do physical education, you won't see how someone can become good, either footballer, either netballer. We need to work out so that we can be able to live longer, to stay with our grandchildren.
The Ministry of Health, in partnership with Uganda Non-Communicable Diseases Alliance, inaugurated the National Physical Activity Day in 2018 under the theme Be Physically Active, Be Healthy. The aim was to sensitize the population about the importance of physical fitness, physical activity and its relevance in preventing non-communicable diseases and keeping healthy.